I'm ADJI SARAWARDENA. I'm Professor of Liver and Pancreas Surgery in Manchester. I'm going to talk about the antioxidant trial which we presented here today. So antioxidant therapy was proposed in the early 1980s in Manchester as a treatment for patients with acute or chronic pancreatitis. The reasoning was that patients with chronic pancreatitis are deficient in key vitamins as part of the cellular process, and these are known as antioxidants. So the theory was that supplementation with exogenous antioxidants, giving patients antioxidants, might help. In Manchester, Joan Braganza, who was a leading physician there, worked with a company to develop a compound preparation of antioxidants known as Antox. This was developed, it's a tablet form, and can be taken by patients with chronic pancreatitis, and it's supposed to help with their pain. She looked at this drug in several small studies, and because of what she thought were successful results, she went on to use it in routine clinical practice in Manchester. But they were very small studies, so there was no definite yes or no answer. So it was used in Manchester, but not used anywhere else. So we thought in 2005, either it's a good thing, in which case everybody should use it, or it doesn't work, in which case nobody should use it. So that was the reason for doing our trial in simple terms. And our trial was that we took patients with chronic pancreatitis. We confirmed that they had chronic pancreatitis by doing a CT scan. So they all had morphological evidence of chronic pancreatitis with scarring and calcification and changes in the duct. And they were randomized to have either Antox or placebo. And they had this for 6 months, either Antox or placebo for 6 months. We assessed the main endpoint, the primary endpoint of our study, was the patient's pain, because that's the important thing. For the patient, for the human being, it's the pain. You know, if they have pain, we said, tell me how your pain is. And we looked at pain in the treatment group and in the placebo group. And at the end of the study, there was no difference in the primary endpoint. In modern medicine, you have to assess what is called quality of life by using a very complicated quality of life table. So we did this as well as assessing the pain scores, and there was no difference in the quality of life. Just to be sure that the patients who had antioxidants had taken this medication, we measured their antioxidant levels, and they were increased in the antioxidant group and not increased in the placebo group. So from this study we conclude that antioxidant therapy, it's been around for 30 years, it's probably not going to be beneficial in chronic pancreatitis. Thank you.